All right. Hello, everyone. I'm Dr. VanderWel here at Eviva, one of the bariatric surgeons here. And this is a seminar where we discuss weight loss options. And thank you for tuning in. I know this is an exciting time. All right. Thank you for tuning in, and let's get into it. All right, here we go. Now we're really going to start. All right, here's the weight loss treatment options seminar. Thank you for tuning in. So, who are we? First of all, Eviva. We have been doing bariatric surgery for actually almost 20 years in our practice, been leaders and innovators in this field. One of the first in the world to do a laparoscopic sleeve in the outpatient setting at an ambulatory surgery center. First in the world to do a gastric bypass outpatient. One of the first in the Pacific Northwest to do laparoscopic sleeves. Published a bunch of papers. And now we've been the first in the Pacific Northwest to do the endoscopic sleeve gastroplasty, the ESG. And we're the busiest practice doing that in the West United States now. Here's our team. 3 bariatric surgeons now. We just had Dr. Tan just joined us, which is very exciting. We have bariatrician, Dr. Tony Burden, medical weight loss ARMP, 2 RDs, 2 surgery PAs, and this team is fantastic. These people are great. You will love them. We love them. I love working with them, and they do a great job. And we get together on a regular basis. We talk about patients. We talk about issues that are going on. Our goal is to really streamline the patient experience, really treat people the way we want to be treated, and help people do really well. And that takes a multifaceted approach. All of us bring different strengths, and so no, this is a great team to work with. I'm really, really, really proud of this team. So we're talking about weight management. Why is it so hard to lose weight? Why is obesity so hard? And I always like to take the 30,000-foot view to start off with, which is our bodies are not made to live in the 21st century. Our bodies are made to survive hardship and scarcity, not comfort and abundance. Your body doesn't believe that wonderful climate controlled buildings that we spend most of our time in, having refrigerators full of food, having Costco available, like everything about the modern living that we live in, cars that practically drive themselves, sedentary jobs for many of us, is very, very anathema to what our bodies are used to in its genetic code. The situations, like I said, mentioned before, the conditions that we would live in, the jobs that we have been doing for historically, the ways that we transport ourselves, types of food that we eat, the way we make our food, all of those things were so different even just 100 years ago. And, that just makes single thing has been a difficulty in losing weight. Obesity is a complex disease. I break it into 6 things. So mindset, diet, exercise, psychology, support, biology. And if you struggle with this one, it doesn't seem to matter how much of your act together you seem to have on this hand. You just are fighting this uphill battle against your body. These tools we're going to talk about today, they're tools to help with this. They're not cures, they're not magic wands, but they're tools. They all have varying degrees of strengths, varying degrees of weaknesses, limitations. They're really good tools. Some of them can be fantastic and really change that uphill battle into a downhill battle so you feel like you're working with your body as opposed to against your body. That is the biggest thing with this thing. So Erica turns in and asked me, thank you for tuning in, and asked about revision surgery. I would be happy to talk about revision surgery. All right. So big picture, right? Got all these 6 things. They're tough. Why can't we just get the work, put the work in? You eat less, exercise more. We got this. Fix all these things. But it's that biology thing. Remember the show The Biggest Loser? No matter how, for most people, that is a success rate of about 5% long term. Many of those people that were in that show actually went on to gain their weight back, and most of them went on to get surgery. So actually have done surgery on biggest loser contestants. So unfortunately, our bodies are really just not really, they just don't believe that obesity is a thing. They're always like, well, no, famine and starvation and freezing to death. That's a thing. Not obesity and having too much and being too comfortable. That's just not a thing. So our bodies are really really made to be efficient with calories, to want calories, to store that energy for later. So what are our options? So in the 21st century, we got to figure out this is just clearly not working. Eat less and exercise more is not a public health intervention. Its success rate is less than single digit, less than 5%. That it's just not okay to say that this is okay, that this is enough. So, like I said, frustrating, disappointing, but this is still an important part of this story. And that's what I think it's really important to talk about too. All these things go together. And really working on our diet and our behaviors and some of the things of why we eat, things like that. That's why we have a whole team of people that work with us. That when we work on all those things to really help you be the most successful you possibly can, not just in that first year after we start one of these tools, but in the many years to come. Because I wish we could do surgery on your genetics or fix your genetics with medication or a right type of thinking, but we can't. And it's going to be a lifelong journey. And that's what this is. It's a journey. So, medications. This has been around for a long time. I kind of break medications for weight loss into the non-injectable medications and the injectable medications like Ozempic and Mounjaro, things that are getting a lot of hype these days. So non-injectable medications, stuff like phentermine. So we use a bunch of other different drugs as well. So like topiramate, naltrexone. Depending on the type of person, depending on what they struggle with, all these things have varying degrees of success and benefit. And it's a great tool. It's a great adjunct, even if you haven't do any of the other number of things that we're going to talk about. But this can be a really helpful thing for a lot of people and really help them get going in the right direction. For some people, it's very successful. But on average, it's about 5 to 10% total body weight loss. Usually, if you stop taking the medication, it can be a challenge to maintain your weight. That's the difficulty with medication. It doesn't really fix anything, except it does give you a chance to maybe reset some behaviors, reset some patterns, which is valuable. So, but how far that goes can be limited for most people. Weight loss is slow. It's okay. So the next one is the GLP-1 receptor agonists. These are the Ozempics or Wegovy. These are semaglutide is its generic name. Mounjaro, tirzepatide, which is the generic name of Mounjaro. These have been really exciting new drugs. They're getting pushed very hard, I'm sure, on your social media stream, any number of these things. And they're for good reason. They're doing some pretty good work. We're seeing some really good weight loss results that we generally don't see out of medications, which is very exciting. And, but they have their limitations as well. Usually we're seeing about 10 to 15%. Some of the Mounjaros are pushing up getting towards 20s. There's some other drugs coming down the pipeline that are seeing even more weight loss, which is exciting to see. But what's the trade-offs, right? So there can be some GI symptoms for many people. We're seeing that it can give you some nausea, maybe some diarrhea. They're very expensive. If your insurance doesn't cover them, like $1,300, $1,000 a month expensive. There are compounding pharmacies that can get the medications for cheaper. I'm sure you've also seen that, for advertised heavily, which, has its pluses and minuses as well, but they're still expensive. They're still hundreds and hundreds of dollars a month. We don't have a lot of long-term data on these things. We don't have years of data for these medications specifically. And especially at the doses that we're using them at. There is some good data though that shows there's some solid data that shows that when people do stop these medications though, it can be a challenge to maintain that weight loss because they do some really good work on a hormonal level. These things centrally in your brain change a lot of your hunger and satiety cues. They affect your GI tract so that it really slows down. It's much more content. It's a good medication for blood sugar management. And these medications, I think, more so than anything in the last 20 years, has shown us that obesity is a disease of biology. And when you have something that can target a biologic target that flips some switches inside of your body, it's incredible what can change. And all of a sudden, it's like, yeah, all of a sudden I can stick to a pretty significant change in my caloric intake and I'm totally fine. I'm okay. And not just I'm okay, like I can follow the diet. I still feel like I have good energy. Whereas before, when I tried without these things, I was just like beating my head against a wall. And that's really, I think this is what these surgeries, they got these hormones because these are the things that are positively changing in surgeries as well. And so it's exciting to see. It's exciting to see. We just need more tools. We need more tools. There are 42 million, 42% of the population of the United States is obese. We just need more tools to help us with this thing. So that's 42%. That's 100 and almost 140 million people, which is an insane amount of people. So now we're going to transition into the procedures. So the first procedure we'll talk about is the endoscopic sleeve gastroplasty, the ESG. This is the newer procedure that we offer in bariatrics in general, in our practice as well. And it's a really cool procedure. You use a suturing device that goes on the end of an endoscope, and it goes down through your mouth and goes down through inside and then goes and takes bites of the stomach. These are full thickness bites with a permanent suture that is able to close down the stomach take it from this large bag down to a small tube, and it reduces the size of that. Nothing is removed, nothing is taken out. Essentially what it does is it ruffles the edge there and crumples it down on the outside. It doesn't really make pockets. When I make my ESG, I don't really make little pockets or cavities. It's really you put in a lot of sutures and it just collapses that outside space of that stomach so that it can't expand. The benefits of this are multiple. There is the restriction benefit of just like your stomach is smaller, so it can't hold as much food, which is a big positive. I tell people I don't want you to depend on like really pushing that stomach to its limit, because as with anything, any small intestine in general, it will stretch over time if you push it to its limit. The thing that can happen with is also that all that surface area, the cells on the surface area on the inside, those are hormonally active cells, and when you reduce the surface area that's in contact with food, it has a significant improvement on all the hormonal cues of like satiety and feeling less hunger, appetite. It helps with blood sugar management, even can help with blood pressure management, interestingly enough. These hormones are doing some real things, and it's the big difference when you see people recovering after these procedures. They're a week, a month, several months down the road. They're like, yeah, I have we have a very specific diet where we try to give you very clear guidelines. Like, okay, yeah, I'm following these instructions, and I'm it's easy. And then maybe it's not easy to execute it sometimes, but it's doable. Finally, it feels like eating healthy in small portions is doable and sustainable. It's just really cool how these things can flip some switches inside that really make it so that, I mean, a good example is in the first month after, the ESG or the laparoscopic sleeve or bypass, most patients are eating somewhere between 450 and 600 calories a day for about a month. Sometimes they're up to about 800 calories. But most of us couldn't. I mean, trying to do 800 calories a day for a month is insane. It'd be crazy. It'd be such an act of willpower and just white knuckling that. And after these procedures, all of a sudden it's just like, yeah, this is just what we do. This is what happens. There's things that are going on in here that make this totally doable. We got energy in the tank, so let's just use that. So this is a great procedure. It's self-pay. That's probably one of its biggest downfalls. That's generally not covered by insurance. This is making progress. We're looking forward to getting this covered by insurance, and we're starting to make some good headway in there. Not quite prime time yet in that regard. We don't have as much long-term data as we do as the other procedures. By this, we have 5-year data. We have 3-year data that shows that it's durable. But it's not like we have 10-year data or 20-year data like we do with the laparoscopic sleeve. We still actually have more long-term data than we do with the GLP-1s, which is where, some people are like, well, I think that's an important thing to remember as well. Recovery is pretty quick too. It's like 4 to 7 days. Usually you feel like blah, like yucky for a few days, and then you kind of wake up one morning and you're like, oh yeah, I'm good. Usually about 2 to 4 days after the procedure. So Shannon, if you had a sleeve already, can you do this one? The ESG, I think you're referring to, Shannon. Yes, so you can do this more after doing an ESG. If you've had a sleeve and your sleeve has stretched over time, it is possible to shrink it down again with an ESG, and we're doing a number of those with our patients. We actually are excitingly, knock on wood, we're looking actually forward to maybe doing a trial on this where we study it in a very systematic way and also study if there's some things we can do to help with heartburn. Because a lot of patients that have not a lot, but there's a decent amount of patients out there, probably at least somewhere between 15 and 30% of all the cohorts of people that are out there with the sleeve have had some increase in heartburn afterwards. And there's some newer procedures that we're also adding to the ESG to try to help with heartburn even more. So, yeah, and Chris is right in the from a price range, it's somewhere between all in all, it's about 15,000 with when you include anesthesia, those things, but that includes the full year of aftercare afterwards and things like that. Cool. Thank you for the questions as well. So, laparoscopic bariatric surgery. So this is the one we'll talk about next. This is what our practice has been doing, 50 for 20 years. Laparoscopic surgery is done by using small incisions, about the size of a pinky and a thumb, and a camera with small incisions, with small instruments that are narrow, about the size of a pen. They can see a picture here. Can we see a picture? Yes, here we go. Picture. You can see you're able to, we're doing surgery on there's a screen out there, and we're kind of our hands in there, we're doing all the surgery on the inside. You blow up the abdominal cavity, which is the space that your intestines live in your stomach, and like your liver and your spleen. And we just blow it up with CO2 gas. And so it gives us a lot of space to work. And it's kind of like you look pregnant essentially just for, the duration of surgery. And then we were able to deflate and remove most of that gas. And the gas that's left in there will absorb over time. And what we're able to do while we're in there is, just kind of like ninjas inside there, is to reduce the size of the stomach or change around the intestinal pattern inside. So the laparoscopic sleeve, we'll start with the gastric bypass here. So the gastric bypass is where you make a small pouch and then you bring up a piece of small intestine, you connect it there, and then you bring up a small piece of intestine, you connect it down here. It's a really cool tool. This is a great operation for people that are looking to lose, a good amount of weight, that have bad heartburn, maybe that have bad diabetes. It's gonna be a very, very good operation for patients. We don't do as many of these in the world as we used to. Well, I guess we do. Maybe that's not necessarily true, but from a percentage standpoint, we don't do as many of these in the world and in our practice and in this country as we do of laparoscopic sleeves as the next operation. This is still a good operation though. There's still the right people for this operation. So it's just a personal decision that you get to talk to about, with your surgeon, and you decide what's going to be best for you, weigh the pros and the cons of all these tools in general. So the laparoscopic sleeve, that's the next operation we'll talk about. And this is kind of, what is widely done across the world in the United States, where you take the stomach, which is that large bag, and you reduce it down to that small tube, and you remove the extra stuff. So all this, I describe this is really, like this surgery, the laparoscopic sleeve and the ESG, this gives us a 21st century stomach. These are great operations for really reducing the size of the stomach. We've been doing this for a long time. It's a very safe operation in our hands, a very effective operation in our hands as well. Yeah, so, so it's not always covered by insurance. It's about 50% of people in Washington, I've heard, have benefits for weight loss surgery. And usually recovery for these is about 10 to 14 days. I encourage most of my patients to take off about 2 weeks off of work after a surgery like this. Many of my desk job people are going back to work within a week, but it's very dependent. Some people take longer. The goal of these surgeries is to change your life. It's not to get you back to work as possible. But many times people are like, oh, I'm kind of bored. I'm ready to go back to work. So these are fantastic tools. These are the surgeries, these are the gold standards. These are the best tools that we have. They're most effective, the most durable, the most data on these things. But, overall, the goal here is to just figure out what's going to be the best tool for you. And that's the thing that we have. We're very proud to offer all of the options. We try to get the medications. We have the GLP-1 injections. We try to get them as affordable as we can. Probably, arguably more affordable than you can get from many other places, with a comprehensive program. Laparoscopic gastric sleeve, gastric bypass, endoscopic sleeve gastroplasty. We can do all of these operations. We just can talk to you about, hey, we've been doing these for a while. Here's our experience. Here's the pluses and minuses of each of them. And we can, and then, at times we'll talk about revisions too in the question and answers about what's going to be the options for people that are looking for a revision and or that have had a bariatric surgery operation. And, because unfortunately we can't do surgery on your genetics, we can only do surgery on stomachs and intestines. And that sometimes there's things that we need to continue to do, and there's more tools that we need to look into because life happens. So, how do you take the next step with Eviva? Reach out to our team, evivamd.com. You can check out our website. If you want to just go right there, /contact us. There it is. You can use that QR code even. Makes it super easy. The way it works, you get set up, we get all your information, get you set up as quickly as smooth line as we can. We do most of our visits by telehealth, which is really, really nice because truthfully, laying on hands in the clinic really doesn't do a lot. These were made, the magic happens in the OR here. And really what we talk about, this actually gives us actually more access and more opportunities to have meaningful conversations and work on meaningful issues that are causing people to not be as successful as they could be, make little course corrections, work on small things, and it's going to make it really easy to have visits. You can just take 15 minutes off from your day while you're in your work, and then go check out, sit down, talk about what's going on, have some action plans, meet again really easily instead of having to take a whole half day off of work, get in your car, find childcare, whatever it is. At your visit, we'll review your medical history, your surgical history. We go over all the options about these tools, and we just listen to you and say, hey, what are you interested in? What do you think? Okay, do you have any questions about these things? What sounds like it's going to be the best for you? And then you start the journey. There we go. Yeah. Okay, maybe not that journey, but yeah, this is exciting. We love this. We love doing this here at Eviva. I say this all the time. I really feel like I win the Super Bowl every week, just seeing our patients do well and having their lives change and just feeling so much better about themselves, feeling more empowered in their lives. And then all the other things like the scale looks better, they feel better in their clothes, their medications are better, they're going to live longer, like 10 to 20 years for some of them when your diabetes is better and your hypertension's better and your sleep apnea gets better. Like it's just a beautiful thing. So this is over in a week, day in, day out. I hear every day. This is one of the best decisions I've ever made, and I wish I just would have done it sooner. It's my only regret. So, all right. Now we can switch over to the Q&A section. All right, Q&A mode. Here we go. So, let's talk about, Erica asked about revisions. So, broadly, we offer almost the entire gamut of revisions, and that is for people that have a laparoscopic sleeve. If you're out there, you've had a bariatric surgery of some sort, even if you've had an endoscopic sleeve, if you have a laparoscopic sleeve, a gastric bypass, any of those things, we can talk about what the options are, and that is endoscopic retightening. You can endoscopically retighten almost any of these surgeries that are dilated. So an ESG that stretches, like if you put too much, if you're forcing too much food into any sort of intestine, it will stretch out over time. That doesn't matter. ESG, laparoscopic sleeve, gastric bypass, all of them can stretch over time. I say these are tools. They're not cures. They're not magic wands. You gotta, know how to use them well to get the most out of them. You gotta take care of them long term to help you get the most benefit. And stretching is something that definitely we see all the time. And so endoscopically, you can actually tighten up a lot of these things in a lot of different ways. That's an option. Laparoscopically, you can go in, you can actually tighten them up. You can reduce the extra dilated stuff that's off of there. Patients that let's say you have like a laparoscopic sleeve and you're looking for some help with your weight, but also you have heartburn. So then we talk about should we maybe talk about doing a gastric bypass? Because the gastric bypass is a great operation for heartburn, and it's really our go-to for helping with heartburn and can provide some additional weight loss benefit. We really enforce, remember those 6 things I talked about before? We really try to get you back plugged in with the team, get you kind of back on track with a couple of these things, and just kind of reinforce some of these things that may have slid a little bit. Or sometimes patients, I got patients I see from all over, right? From all over the country, or maybe they went to Mexico, or maybe they had their surgery 10, 20 years ago. There wasn't any follow-up, but they didn't really like have clear guidelines or have a clear vision of what they were supposed to be doing. So we kind of, restart there. We do some re-education, things like that. Um, and then if you've had a gastric bypass, we have a bunch of different options that we can offer there as well. So we do things like we can tighten it up endoscopically, we can tighten it up laparoscopically, we can, make the bypass portion of the intestines longer. And yeah, there's quite a few options. We can talk about medications. We can do any of those things. So I think we if you've had more an exotic bariatric surgery like something like a BPDDS or a vertical banded gastroplasty, or maybe you just have a lap band, an old lap band, and you're looking for a different operation, we take care of a lot of that stuff too. And so it's all about just finding what surgery that you have and which one that you're looking for next. So if you have any other further questions, you're welcome to put them out there. So I think Shannon even asked if you had a sleeve, can you get an endoscopic sleeve, endoscopic retightening? And absolutely, yeah, you totally can. So, and I think that's a really exciting field that we're just starting to foray into in the endobariatric world. We're very active in the endobariatric community. I teach a bunch of the courses to teach people endoscopic sleeve gastroplasty. We talk at meetings, nationally and internationally. And I think, it's a really exciting time for this stuff, and it's really exciting to see how these tools are helping people. So, all right, great. Thank you for the questions. Okay, got some questions coming on the text, man. On the text, are any of these surgeries going to give me cancer? The short answer to this is no, they're not. The chance of you getting cancer after these surgeries actually goes down. There's over 10 types of cancers that actually reduce their incidence after you've had bariatric surgery and you've lost a significant amount of weight. Bariatric surgery itself even seems to have some sort of cancer benefit for reducing its incidence. Being obese is a chronic inflammatory state, and these surgeries really help with a lot of those things, even right away. I have patients even with rheumatoid diseases like rheumatoid arthritis, or some other autoimmune disorders, that are worsened by inflammation in the body, and even just after surgery, even without losing tons of excessive amounts of weight, they notice that they're feeling better and that things are improving actually inside. And maybe their joints are feeling better even before they've lost, a very significant amount of weight. So it's cool. These things are, from a surgery standpoint and from the endoscopic sleeve standpoint, those things are doing some really cool stuff. The GLP-1s are doing some really exciting things too, and I think it's been a good tool. And all these things can work together as well. So obesity fights dirty. So I think we need to, do whatever patients are interested in doing, and kind of have all the options on the table. So, all right. Well, I think that's concludes all the questions that I got coming in here. So thank you for all the engagement, and thanks for tuning in. I know we're going to try to do more of these seminars at some off-hour times, because I know not everyone can participate in the middle of the day. So yeah, excited. We're always happy to help here at Eviva MD, and yeah, there's hope out there. And struggling with obesity is really hard, and it can be a very difficult journey on so many levels. And we understand that. We've been doing this for a long time, and we do what we do because we love helping people that are struggling and helping you, and just love seeing you get better. So, all right. Well, thanks again, everyone, and I'm excited. If we can help you, we're always happy to. So thank you, everyone, and have a great day.